Outneys. Asterisk Session 1. Introduction to Occupational Epidemiology Nov 18. Session Objectives. To describe epidemiology and occupational epidemiology. To discuss the historical antecedents of epidemiology. To define and differentiate the following. Distribution of disease versus determinants of disease. Risk assessment vs. risk management. Causal factor versus etiologic agent. To describe the goal and the purpose of epidemiology. To explain basic concepts in occupational epidemiology. Scenario, clinician vs. epidemiology. A patient with diarrhea of 5 days duration comes to your clinic in a tertiary hospital. What information to obtain? How to obtain information? Ask AI. Alt. The table compares the approaches of a clinician and an epidemiologist in collecting and analyzing data related to health issues. Here's an explanation of the key points. Data collection. Clinician collects data on an individual patient level. Epidemiology collects data on a group level, including patients and others. Focus on cause. Clinician focuses on diagnosis, DX, of the disease and identifying the specific agent causing it. Epidemiology looks at the broader cause, focusing on exposure or source of the health issue. Management/intervention. Clinician manages the disease through treatment, RX. Epidemiology implements public health, PH, interventions to prevent spread or recurrences of the health issue. This table highlights the different scales and approaches used by clinicians and epidemiologists. While clinicians focus on individual patient care and treatment, epidemiologists take a broader, population-based approach to understand and prevent health issues. Definition of epidemiology. Epidemiology is the study of the distribution and determinants of health-related states or events in specified populations. Last, 1988. Last J.M., Editor. Dictionary of Epidemiology. 2nd ed. New York, Oxford University Press, 1988. Epidemiology is the study of the distribution and determinants of health-related states or events in specified populations, and the application of the study to the control of health problems. Last, 2001. Last J.M., Editor. Dictionary of Epidemiology. 4th ed. New York, Oxford University Press, 2001. Asterisk components of the definition. Specific population. Group of people. Can be defined. Person characteristics, age, sex, occupation, etc. Place. Administrative subdiv, BRGY, province, etc. Economic subdiv, first class, etc. Environmental subdiv, coastal/upland, rural/urban. Location relative to a feature in the environment. Time. Components of the definition. Distribution of health-related states. Frequency by person, place, time. Determinants. Factors capable of bringing about change in health state. Risk factors, harmful. Protective factors, beneficial. Disease determinant, risk/protective factor. A characteristic, behavior/lifestyle, an environmental exposure, or an inborn/inherited characteristic, which on the basis of epidemiologic evidence is known to be associated with health-related condition or to influence a certain outcome. Factor, outcome. Health-related states or events. 6Ds of epidemiology. Disease, death, discomfort. Disability, dissatisfaction, destitution. Application of preventive measures. Applying the knowledge gained from studies to community-based practice. Summary. A. Distribution. B. Determinants. C. Application. Compare food histories between cases of Staphylococcus food poisoning and non-cases. Compare frequency of lung cancer between those working in shipyards and those in the general population. Mark on a map the residences of all children born with birth defects within 2 miles of a hazardous waste site. Graph the number of cases of congenital defects by year for the country. Tabulate the frequency of clinical signs, symptoms, and place of residence among patients diagnosed with a new type of disease. We also continue to encourage women and their partners in areas with active Zika transmission to engage in pregnancy planning and counseling with their healthcare providers so that they know the risks and the ways to mitigate. Sample: radium dial painters, another cancer hazard. Indiscriminate exposure to ionizing radiation has occurred in many industries besides mining. From 1915 to 1929, about 2,000 U.S. women were employed to paint the faces of clocks and wristwatches with radium paint. By the early 1920s, it became clear that many of these women were developing a rare and disfiguring facial cancer of the paranasal sinuses. The U.S. Bureau of Labor Statistics set up a cohort of 260 women, which was later maintained by Argonne National Laboratory. Beginning in 1924, it was strictly forbidden for workers to tip the brushes in their mouths. In the 1950s, more than 20 years after most exposure stopped, 396 women were examined, and their body burden of radioactivity measured via a breath exhalation test. The 226 women who were first employed between 1915 and 1924 had a mean body burden of 21.19 mCi. This simple industrial hygiene measure reduced the exposure by over 90%, so that 170 women hired between 1925 and 1929 were eventually found to have a mean body burden of only 1.25 mCi. Historical antecedents of epidemiology. 400 BC, Hippocrates. Rational rather than supernatural viewpoint about disease causation attributed disease causality to environmental factors. Environment is a factor in disease causation. 1662, John Grunt. Employed quantitative methods in describing pop vital stat, presented mortality data in tabular form, noted disparities by sex, age, urban/rural, season counts of events/frequency distribution utilized. 1880, William Farr. Father of modern vital stats and surveillance. Collected/analyzed Britain's mortality data, disease classification. 1854, John Snow. Father of epidemiology. Investigated cholera outbreak marked the formal beginnings of the field of epidemiology, descriptive epidemiology, disease distribution, natural experiment, disease determinant. ASCII. Alt. ASCII. Alt. This table presents data on cholera deaths in Golden Square, London, supplied by 2 water companies from July 8 to August 26, 1854. Here's an interpretation of the key information. The table compares 2 water supply companies, Southwark and Lambeth. Southwark supplied water to a much larger population, 167,654, compared to Lambeth, 19,133. There's a stark difference in cholera deaths between the 2 areas. Southwark area, 844 deaths. Lambeth area, 18 deaths. The cholera death rate per 1,000 population shows an even more dramatic contrast. Southwark, 5.0 deaths per 1,000 population. Lambeth, 0.9 deaths per 1,000 population. This data suggests a significant difference in cholera incidence between the 2 water supply areas, with Southwark having a much higher rate of cholera deaths. This information was crucial in John Snow's investigation of cholera transmission, supporting his theory that cholera was spread through contaminated water rather than bad air, as was commonly believed at the time. Cholera rates high in areas supplied by 2 companies, Southwark and Lambeth. Source: polluted part of Thames River. After 1848, Lambeth later relocated its source to less polluted area. Cholera incidence. 1847, Ignace Semmelweis discovered that the incidence of puerperal fever could be drastically cut by use of hand-washing standards in obstetrical clinics. Puerperal fever, or childbed fever, was common in mid-19th century hospitals and often fatal. Vienna General Hospital's first obstetrical clinic doctor wards had 3 times the mortality of midwife wards. Modern epidemiology. Chronic diseases, 1930s to 1940s. 1948-1949, Framingham study. Risk factors for CHD. Longitudinal study of a defined population in Framingham, Massachusetts. 5,209 Framingham men and women between the ages of 30 and 60. Relationship between given characteristics and the risk of death from heart attack. Produced a landmark report. Predictive power of blood pressure, blood cholesterol level, and cigarette smoking for heart and blood vessel diseases. 1951/post WW2, Dahl and Pito study. Smoking and lung CA among British MDS. Longitudinal study. 34,440 male British MDS surveyed about their smoking habits and followed for 20 years. A long-term follow-up study of British doctors indicated a strong association. ASCAI. Alt. Some non-smokers developed lung CA and some heavy smokers did not develop the disease. A number of factors contribute to causation, theory of multiple causation. Some factors are essential for the development of the disease and some increase the risk of its development, sufficient component cause model. https://www.studocu.com/ph/documents/university-hife-of-research-life-reviewers-life-writing/reviewer-biostat-hyphen-ms-hyphen-tumuli/356213144 https://www.scribd.com/documents/385846599/introduction-to-epidemiology. Ideas derived from history of AP. Human disease is related to man's environment. The counting of natural phenomena more instructive. Natural experiments can be utilized to investigate disease causation. Uses of epidemiology. ASCAI. Alt. This diagram illustrates the uses of epidemiology in 4 main areas. 1. Causation. It shows how genetic factors and environmental factors, including lifestyle, contribute to good health, which can lead to ill health. 2. Natural history. This depicts the progression from good health through subclinical changes and clinical disease, potentially leading to either death or recovery. 3. Description of health status of populations. This section uses a pie chart to show the proportion of a population with ill health versus good health, and a graph to illustrate how this might change over time. 4. Evaluation of intervention. This shows how treatment, medical care, health promotion, preventive measures, and public health services can influence the transition between good health and ill health. Overall, this diagram effectively summarizes how epidemiology is used to understand health at both individual and population levels, from disease causation to the evaluation of health interventions. Goal of epidemiology: identification of disease determinants, prevention of disease. X, unknown organism but known. Risk factor rightward arrow prevention effective. Cholera. Water as reservoir identified, 1853 John Snow. Vibrio organism identified, 1884 Robert Koch. Typhoid. Human carrier identified, 1858 Bud. S. Tiffy organism identified, 1880 A birth. Yellow fever. Aedes aegypti mosquitoes ID as vector, 1901 Walter Reed. Virus identified, 1928 Stokes. Puerperal fever. Contact spread, 1861 Ignace Semmelweis. Microorganisms ID much later. Legionnaire's disease. Airborne, air conditioning system in a hotel, 1976 CDC. L. pneumophilia isolated, 1978 CDC. Toxic shock syndrome. Use of tampons, 1980s. Biologic mechanism understood 5 years later. Scope of epidemiology. Infectious diseases. Non-infectious diseases -1930s. Injuries and violence -1980s. Molecular and genetics, 1990s. Occupational/NVAP, 20th century. Occupational/environmental epidemiology. Occupational epidemiology. AP studies. Environmental epidemiology. Key concepts in environmental epidemiology. Summary. Session objectives. To describe epidemiology and occupational epidemiology. Occupational/environmental epidemiology. Occupational epidemiology involves the application of epidemiologic methods to populations of workers' risk factor. Study population. Group of workers, plus, exposure. Group of workers, plus, disease. AP studies may involve looking at workers exposed to a variety of chemical, biological or physical, example noise, heat, radiation, agents to determine if the exposures result in the risk of adverse health outcomes. Looking at exposure to determine the disease it results into. ASCII. Alt. May involve looking at workers with adverse health outcome to determine if an exposure to an agent or set of agents may explain their disease. Looking at diseases to determine what exposure resulted to it. ASCII. Alt. ASCII. Alt. Smoking, asbestos, and lung cancer. Asterisk smoking and asbestos interact synergistically. Exceedingly high lung Ca rates who both smoke and are exposed to asbestos. AP studies can provide quantitative measurements of the contribution of the various factors to disease causation, attributable fraction, etiologic fraction, preventable fraction. https://www.osha.gov/occupational epidemiology/hazards. Environmental epidemiology involves the use of epidemiologic tools to study communities that may be exposed to pollution, hazardous waste, radiation through air, water, or food contamination. Methyl mercury poisoning, 1950s. Hg compounds released with the wastewater of a factory into a small bay in Minamata, Japan. Accumulation of methyl mercury in fish, causing severe poisoning in people who ate them. First reported epidemic of a disease caused by environmental pollution. First cases thought to be infectious meningitis. But orienting the disease by place showed that of 121 cases, most resided close to Minamata Bay. Orienting the disease by person showed that victims were almost exclusively members of families whose main occupation was fishing. Thus, something in the fish had poisoned the patient, not communicable/not genetic. Key concepts in environmental epidemiology. Important role of environmental factors. Often studied in isolation, but environmental factors can influence each other's effects. EX possibility of noise/solvent interaction in hearing loss, 20-year cohort study in Sweden, 1958, Bergström and Nyström, 1986, concepts, Conti. Hearing loss impairment high in a chemical company where noise levels were significantly lower than other occupational groups. Industrial solvent as additional causative factor in hearing loss. Bergström and Nyström, 1986. Exposure, level and duration. Past exposure versus current exposure. Plus, cumulative effect. Consider past exposure and duration. Individual vs group measurements, variation in exposure levels across individuals due to differences in work habit, local distribution of a pollutant, individual absorption/excretion. Individual measurement, biologic measurement level in body fluids/tissues. Hair, exposure to methylmercury. Nail clippings, arsenic. Feces, metals ingested via food. Breast milk, organochloride, pesticides. Group measurement. Mean/average. Common. Percentiles. Sum of individual doses. Environmental monitoring versus biologic monitoring versus history of exposure. Environment, external dose. Biologic, internal dose. Dose effect/response relationship. Dose effect relationship, health condition as a consequence of exposure to a certain dose. The higher the dose, the more severe/intense the effect. Effect varies across individuals. Dose response relationship, proportion of an exposed group that develops a specific effect. The higher the dose, the greater the number of exposed with the effect. Risk assessment and risk management. Risk assessment. Estimate potential health risks of industrial activities while in operation. Predict potential health problems in the use of new chemicals/technologies. Risk management. Planning and implementation of actions to reduce or eliminate the health risks. Risk assessment, steps. Identify environmental hazard the industrial activity/technology of interest may create, biologic hazard/S. Chemical hazard/S. Hazard assessment. Health effect of the particular hazard. Measure the actual exposure levels for the people potentially affected. Calculate health risk in the population. Occupational epidemiology. Occupational health. Promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations, who begins with an assessment of risk, ID of hazards and an appropriate estimation of the risk arising from them, with a view to making inter-risk comparisons of purposes of their control. Summary. Session objectives. To describe epidemiology and occupational epidemiology. To discuss the historical antecedents of epidemiology. To define and differentiate the following. Distribution of disease versus determinants of disease. Risk assessment versus risk management. Causal factor versus etiologic agent. To describe the goal and the purpose of epidemiology. To explain basic concepts in occupational epidemiology. References.